we discussed the fact that the current therapies are all focusing on the adaptive immune system, of the focal inflammation, the inflammatory events that are typical of the early stages of MS. And we pointed out that disease mechanisms are occurring long before you have the first symptom, and long after you go into the late progressive phase in which inflammation is no longer present in the same way. And this indicates that there are other mechanisms that are also at play in MS. So the concentration focal inflammation only gives a certain part of the answer how to treat MS. So there is very evidently a void there in our full capability of controlling this devastating disease. There are elements of neuronal loss, of brain volume loss, which is very, very insidious but very stable throughout the course, which doesn't seem to be connected very, very sharply with the focal inflammatory changes. And this is really interesting and potentially very important, because the current drugs we have, they do a lot of good, but they don't do everything. They don't prevent many of the patients from becoming progressive, and they seem to have very little effect in the progressive phase, maybe a little bit in the beginning, but probably not in the long run. One of the takeaways of the presentations and discussions today was that you need to use the tools you have, but you also need to recognize that there are limitations with those tools, and there is a need to develop new drugs. To what extent is that important for the practicing neurologist? Well, I mean, you need to manage your patients. You need to understand what kind of future that patients are looking at. That future is becoming better. We've seen in the registries. People progress more slowly. Maybe we can save people from coming into the progressive phase. We don't know that for sure, but we can at least prolong the relapsing phase. And then also, of course, colleagues need to participate in the development of new drugs. I mean, we need a number of new clinical randomized trials, multicenter ones, and our colleagues around the world need to participate in these.